Hello, in this video, I'm going to talk about the layers of the wall of the heart. So, of the heart itself, we have three layers. And I say it that way because there are three layers of the heart, and then there's the pericardium surrounding the heart. So, we're going to talk about both. So the three layers of the actual wall of the heart include the epicardium, that's the outermost layer, the myocardium, that's the meat, that's the cardiac muscle of the heart, and then the endocardium is a very thin lining inside the myocardium. So, starting with the epicardium, it is also the visceral layer of the serous pericardium. So, we're going to talk about that too once we talk about these first three layers. So, we'll talk about what the pericardium is. But this is an unusual circumstance where the serous pericardium, the visceral layer of the serous pericardium, is considered both a layer of the pericardium and the outermost layer of the heart. So I'll explain that more thoroughly in a minute here. So the epicardium is the most external of our three layers of the heart. It's a thin, transparent outer layer of the wall. Then the myocardium, that's the muscle layer. It's the middle layer of the heart, and it makes up the bulk of the heart. It's made of cardiac muscle tissue, and it contracts and is what causes the actual pumping and beating of the heart. Then lining the inside of the myocardium is the endocardium. That's the innermost layer that lines the inside of the myocardium. It also covers the valves of the heart and it covers the tendons that anchor the valves. And it's a continuous lining that lines the inside of the heart and continues and lines the inside of the blood vessels that are entering and exiting into the heart. Okay, so on to the pericardium. So the pericardium is a membrane that surrounds and protects the heart and holds it in place. So the heart is not just free floating in the thoracic cavity, it is contained inside of the pericardium, which in and of itself has its own layers. It's made up of two parts. The fibrous pericardium is this tough outer shell. So it's this tough, fibrous, dense outer covering that is very protective of the heart. So it's tough, it's inelastic, so it's not stretching as the heart is beating. Dense, irregular connective tissue, so it's tough, it's got collagen fibers going in all different directions, and it prevents overstretching of the heart. So it sort of contains the heart, so there's a limit to how much the heart can stretch. It provides protection and it anchors the heart in place inside of the mediastinum. So the serous pericardium, that's the other part of the pericardium, it is a serous membrane. So we have serous membranes covering almost all of our visceral organs. A serous membrane is where we have a membrane. So we have connective tissue and epithelial tissue forming a membrane and covering a visceral organ for the purpose of reducing friction. So it's like the lungs are covered in a serous membrane so that as they're expanding and contracting and there's a lot of movement, they're not creating friction as they're moving inside of the parietal cavity. Okay, so and same with all of our visceral organs in our abdominal cavity. So, um, when our organs, our intestines, liver, all these different organs, they're all covered in serous membranes for the purpose of reducing friction when they're rubbing against other organs. So in this case, we've got the heart inside of this nice fibrous capsule essentially to keep it safe. But if the heart is beating and it's moving inside of that fibrous capsule, it would create a lot of friction and that would injure it very, very quickly. So we have this serous membrane. In this case, we just call it the serous pericardium that is covering the heart, and it's a buffer to reduce friction between the heart and the fibrous pericardium that surrounds it. Okay, so the serous pericardium is the inner part of the pericardium. It's thinner, it's more delicate membrane that's not for protection from like impact or anything like that, but it's for protection against friction. So it's very, very thin and delicate because its job is just to secrete fluid so that it's more slippery and we don't have friction damaging the heart. So the serous pericardium, and this is true of any serous membrane, it is made up of two layers. There's the parietal layer. That's the outer layer of the serous pericardium. The parietal layer is always the layer of the serous membrane that is lining the inside of whatever the cavity is that contains that organ. So in this case, it's lining the inside of the fibrous pericardium. And then there's always a visceral layer of any serous membrane, and that's the layer that is directly adhering to the organ that the serous membrane is protecting. So in this case, the visceral layer is the visceral layer of the serous pericardium is directly adhered to the heart. Okay, so we have the parietal layer that is lining the inside of the fibrous pericardium, and the visceral layer that is adhered to and covering the outside of the heart. Then there's a little bit of space in between those two layers. So both layers are secreting serous fluid. It's just this slippery fluid. It's kind of like mucus, but more slippery and less sticky. And so it's secreting in between these two layers so that the heart, with the visceral layer covering it, can move freely inside of the fibrous pericardium that is lined by the parietal layer. So it's slippery between the two, so there can be movement without having friction. And the pericardial fluid, that is the fluid that is in between. Now, again, I want to highlight that the visceral layer of the serous pericardium, so this slippery layer that is covering the heart and secreting serous fluid, is also what we call the epicardium. So the epicardium, that is the outermost layer of the heart, and it is the deepest layer of the pericardium. So this is a rare case where we have one thing, one structure, in this case it's one layer, that we define as both the most superficial layer of the heart and at the same time it's the deepest layer of the pericardium. Okay, thank you so much for watching.